Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome. We're joined today by Dr. Dave Pierce, the Chief Medical Officer at the Buffalo General Medical Center and the Gates Vascular Institute. Welcome, Dr. Pierce.
Good morning. How are you?
Good, thanks. So I know the Buffalo General has been one of the focal points for the coronavirus, in particular, your intensive care unit as well. So if you can, tell us a little bit about the Buffalo General over the last couple of weeks and how you guys have been dealing with this.
Sure. What might be helpful is to run down a little bit of what we've been doing internally and kind of the message that goes out to the physicians and our staff. And what I typically do is we have a meeting on a daily basis and we run through all the hot spots and all the things that people really need to know about. And I'll start off with our surge plan. One of the most important aspects of preparing for something like this is really to make sure that we're not thinking about today and tomorrow, but we're actually thinking 3-4 weeks down the road and looking at what's happened around the world and throughout the country. We've been very thoughtful in following the mandate from the governor to increase our capacity for ICUs as well as our capacity in general. And when you look at what happens, in a pandemic like this, the areas that are hit the hardest are the intensive care units. So we've spent a lot of time preparing those units, additional areas in the hospital we can create ICUs out of. But the most important piece becomes the staff and the physicians to be able to care for the patients. So our intensivists have stepped up far and above what anyone could have imagined. And in addition to that, the other physicians, some people that have retired in the community, some emeritus, some people that have just, have never had ICU experience, they've all come to the forefront and said, we're willing to help and do whatever we can. So under the guidance of our current ICU physicians, we've now put together multiple teams that will be able to care for, in the event that something happens, hundreds of patients and turning the hospital largely into an ICU if we ever needed it.
So at this point, as we're early into April and we're about 30 days into this pandemic, it seems like from a system standpoint that the coronavirus has been managed thus far from a crisis standpoint. So, and the patient volume is maybe leveled off or kind of plateaued right now. How much planning goes into situations like this?
The amount of planning that's gone into this has been unbelievable. The number of hours that everyone in our system has spent just prepping for what could happen has been unbelievable. Most of the people have not slept. Another area that I have to mention and give a call out to is our lab services. So people like Dr. Tomaszewski and his whole team, to get us to the point where we're able to do hundreds of tests a day. And then over the next week, the hope is to increase that 3 to 4 times, has been remarkable. And that has given us the ability to really focus on getting patients to the appropriate areas of the hospital, to understand what you're dealing with as people are getting more ill, and then ultimately segregating people both in the hospital and allowing people to quarantine at home. So that has been a huge part of our success.
So, Dr. Pierce, today you and I are practicing the social distancing. That's something that the organization really took serious, almost a month ago now, following some of the local and state decisions. Tell us a little bit more about the importance of that and why getting, people out of the office, getting people out of the hospital that don't need to be there, restricted visitation, masking, continual cleansing, why all that matters in a situation like this.
That's a good question. The countries that have really struggled and have really been hit hard, when you look at how easily coronavirus has spread has been, has really been the central focus of looking at what happens in an environment where they don't do social distancing versus an area where they do a very good job at it. And the areas where they haven't done a good job of social distancing, you look at some of these logarithmic curves where you have the number of patients in a hospital are doubling every 2 to 3 days, and it just keeps going up, and it very quickly overwhelms all the resources of their healthcare systems. When you see the social distancing, and it's been done effectively, where you keep people away from each other, you do masking, like we've done universal masking, we're trying to keep people at work from home programs, just trying to keep the physical contact to a minimum. Instead of seeing this quick spike, what we've seen is that we do have a gradual, slow increase, but at this point, we're prepared for a significant surge, but at this point, what we have seen is not a surge, but more of a trickle, and it's allowed us the opportunity to keep up with providing the resources and the care that patients need.
You're emergency trained, so you've seen everything from H1N1 to SARS, Ebola in your career. What makes this situation so much different from a physician perspective?
One of the challenges of this, number one is that it's very easily transmitted. The other part of it is that several of the other diseases we faced in the past, whether it's SARS or Ebola, those patients are very obviously sick. I mean, very, very sick, and many of the patients actually die. The mortality is very high. The mortality is not as high with this, but it's extremely infectious, which means that you're more likely to transmit it when you're not having symptoms, when you're just moderately ill, which means that these people are not necessarily in an ICU in very bad shape. They're out in the community. So that's where the social distancing becomes so important. But we've seen young people, seen people on ventilators. So it's a very real threat. And it's something that I've never experienced before on this scale. So I think it's been a very real, very hitting home type of an experience that I've never had before.
So, Doc, as we wrap up, you come across and have to work with various amounts of teams across the hospital. You mentioned the intensivists before. There's the ER docs. There's respiratory therapy. Some of the surgery folks are helping as well. If you can, any words of encouragement for them and thanks for them for all that they've done thus far?
So our entire team, the number of people that have stepped up, and you talk about, there are certainly people that are on the forefront that are dealing with undifferentiated patients in the emergency department, and they have behaved like the consummate professionals. They've stepped up to the task. They haven't complained. They've worked extremely hard. The same thing goes with our surgery partners. People have stepped up and said, where do I volunteer? How do I get in? That's not just general surgery. That's neurosurgery, orthopedic surgery, general surgery across the board. And then even all of the hospitalists and everyone who is really in the hospital, subspecialists, urologists. I can't thank everyone enough for the amount of time, effort, and their willingness to do anything necessary to care for our community has been absolutely something amazing to see.
Well, Doc, we know that you guys are busy, have an awful lot on your hands, so we do thank you for taking the time today. Thanks for joining us on Medically Speaking.
All right. Thanks, Mike.